Medical Tourism Corporation interview with Dr. Marco Sarinana, bariatric surgeon from Mexicali, Mexico. Mexicali is the twin city to Calexico in the United States and about 2 hours from San Diego, California.
Well, my name is Dr. Marco Sarinana, and I'm a bariatric and endoscopic surgeon. I studied here in Mexicali, med school, and then I did my surgical training in 1 year in Zacatecas, here in Mexico, in Aguascalientes. Then I went to work and completed my training in endoscopic and bariatric surgery in the city of Tijuana. I spent 6 months in Brazil with Dr. Cohen doing gastric bypass and metabolic surgery. Well, he's one of the world's largest bypass surgeons, and he does around 11 surgeries a day, and he's doing right now a very large study on metabolic surgery and all the benefits that it has for obese and non-obese diabetic patients. And we have done around 1,200 procedures here, bariatric procedures between gastric bands, gastric sleeves, gastric bypass, and gastric balloons. We have restrictive procedures and non-absorptive procedures. The restrictive procedures are the gastric band and the gastric sleeve. If a patient wants the gastric band, we can do the gastric band. If the patient wants the gastric sleeve, we can do the gastric sleeve. The basic difference is that in the gastric sleeve, we have to cut 80% of the stomach, and some patients don't want any mutilation on their body, so they go with the gastric band. That it's a small dispositive that it's put in the esophageal gastric junction, and you have to feel it. And there's a lot of follow-up with the gastric band, and that doesn't happen with the sleeve. But if the patient wants the gastric bypass has more specific considerations, because the gastric bypass is a malabsorptive procedure, and the patient has to know that he or she is going to have to take vitamins and vitamin supplements for the rest of their life. Okay, so what we are doing basically right now, the gastric sleeve is a very popular procedure right now, and most of the American patients that come here to us want to get the gastric sleeve done because it has almost the same results as the gastric bypass, but without the malabsorptive part of that. Well, Mexicali is a very safe city. It's the safest city on Baja California and all over all the region here. And our hospital is located right next to the international border crossing here from Calexico to Mexicali.
Hi, my name is Alexandra, and I'm in charge of public relations. We're going to be in charge of picking you up at the San Diego airport. We're going to take you to the hospital in Mexicali, and we take you back to the airport. And I'm going to make sure that your stay here is very pleasant.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote and more information.